Split or shared visits coding update. Split shared means a service provided in a facility setting whereby a physician and a non-physician practitioner who are in the same group practice provide a portion of a visit to a patient on the same date of service. The provider that bills for the service provides the substantive portion. As per AMA guidance, when using time as the leveling factor, the provider who spent the majority of the face-to-face or non-face-to-face time performing the service will determine the level. When using MDM as the leveling factor, the provider who made or approved the management plan for the number and complexity of problems addressed and takes responsibility for that plan and the inherent risk of complications morbidity of patient management will determine the appropriate level. How to select MDM medical decision making. 3 contributory elements of MDM, 2 out of 3 must be met or exceeded. Number and complexity of problems addressed. Risk of complications morbidity of patient management. Amount and/or complexity of data reviewed and analyzed. Things that count as data. Review of tests do not have to be personally performed by the provider reporting the split shared service. Order of tests do not have to be personally performed by the provider reporting the split shared service. Assessing independent historian narratives do not have to be personally performed by the provider reporting the split shared service. Independent interpretation of tests must be personally performed by the provider reporting the split shared service if using for level selection. Discussion of management or test interpretation must be personally performed by the provider reporting the split shared service if using for level selection.